So, hello everybody. Um, this is another one of our education sessions. It's sort of an end of year roundup, this one, so it's slightly different and maybe slightly more time limited than some of the other topics we've covered. I'm Chris Carrigan. I'm the data advisor for Use My Data, and I'm the one who puts most of these sessions on. This one is a bit of a look back at what's happened in the last 12 months and some thoughts, some from me, about what might be coming up for the next 12 months that might be of interest to Use My Data in our world. There is absolutely no doubt there'll be things I've missed in my sum up of the year because I've been quite selective. So I'd be really interested if I miss things that you think are really important that are worth thinking about. We'll have loads of time at the end to go through those. And particularly when I look at the forward view, many of these are my opinions, my perceptions. So if others have got views or insights or just disagree vehemently, feel free to say. So I shall share my slides. So hopefully you should now be able to see that. Okay. So this is a backwards and forwards look. So I'm trying to figure out what the best way of doing this is, and I thought, well, why don't I just pick up on some themes around things which interest us as a group? The whole question of patient and public trust, stories and how they appear in the media, problems that researchers continually have in accessing data for their research, and then pick up on things like government and policy, and have a look at Use My Data towards the end as well about what we've done and what we might be wanting to do in the future. So my first question I was asking myself was around patient and public trust, and I said, well, do the public have any better understanding of patient data in the past year? What's changed from this time 12 months ago? I suppose my own perception is I'm not sure the public have that much of a better understanding about the use of data. They become more aware of things as they've appeared in the media. I'll touch on those in a second. But I don't think there's been any huge sea change in understanding about the use of patient data in the public. There are some initiatives which have been going on in this last year. So one is from NHS England, the Department of Health, this thing called a large-scale public engagement exercise. So they spent a chunk of money and asked an external agency to recruit panels, to have discussions on particular theme topics, to do fairly large surveys on particular subjects or questions, and then put forward deliberation groups. So they bring people together for a weekend and have a complex conversation over a long period of time with a group of people to try and have a bit more in-depth exploration about the views of the public about certain things, such as the way patient data gets used, commercial use of data, things like the opt-outs, for instance. So I think NHS England have to take some credit for putting some money and some backing into this. They have done what they said they were going to do. And interestingly, the new government came in and said, this is a good piece of work. We want it to continue. It may tweak a bit, but it will continue. So that's certainly something which is different from this time last year. Some of the results will begin to feed out. Most of them will begin to feed into government policy. But I think that was a positive thing that had happened. My other perspective is that if you look at initiatives such as One London, which has been going on for a good few years now, so if you haven't seen it, this started needless to say, in London a good few years ago, where Londoners were brought together in a fairly large group of maybe 100 of them, and were asked their views on lots of topics around data. And that's developed over many years and been continued to be funded and supported. And as an initiative, talking to people, Londoners in this case, about their perceptions about the uses of health data, it's actually quite positive. So if you haven't read up about that, it's worth having a read. In fact, if you want to, we could get them to come and talk to one of our sessions. So that was a real positive, but it's a few years old now. It continues, but I haven't really seen it like in Yorkshire or Manchester or Newcastle or wherever. There are smaller scale initiatives, but not anything as substantial and as impactful as the One London piece of work. So I've not seen a huge impact in that area. The second question is, as a result of anything that goes on, as a result of living in the world, do the public have any better trust in the use of patient data? Now, this is much more difficult, more subjective in a way to try and understand, but there is one measure of you might call trust, which is the opt-out rates in England. Now, just a reminder that England have given their patients the ability to opt out of their data being used for certain things, outside the direct care. It's not a blanket opt-out. It covers certain things, not everything. But patients, it as an individual, you can go onto the NHS app, you can log on the website, you can talk to your GP. There's a way of expressing your opt-out, and people can opt out of their data being used outside of their direct care. And it's a real measure. What you do see is the opt-out rates change depending on stories in the media, and I've got an example of that for you in a second. But if we just looked at opt-out rates themselves, that's the current figure. So I downloaded this morning. There's a website we can go on. If you just look for NHS data opt-outs dashboard, it'll take you to there. It's an open dashboard. It runs on most technologies. It's not brilliant on a phone, but certainly on a Mac and a PC, it's fine. And on an iPad type mobile device, it's fine. And you can cruise through and you can manipulate this as you want by time and by various conditions, and you can break down by groups and geographies. But this is the top level picture you'll see when you go in. And just briefly, it shows the number of people cumulatively who have opted out their data being used beyond their direct care. So right at the left-hand side, that goes back to the initial launch of the opt-outs, and there's a big spike there, obviously. And it's maintained relatively steady, but it's still seeing a net increase. There's two things I'd like you to point out here. The latest opt-out rate at the top, 5.55% of population in England have opted out of their records being used. That's not an insubstantial amount, 3.5 million nearly. There are other bits at the bottom of the graph in the chart. The bulk of this was obviously well in the past. But you will see as you move along the timeline through the different years, there are blips that come in where that's increasing number of people, additional people that have opted out of their data being used. And the main thing I pick up from that is, first of all, there's never been a negative blip. There's never been anything that pushes the number below the line. And secondly, they appear to happen at specific times. And this is in direct relation to things like media stories. I'll ask you to keep an eye on the one around June 24. This current year just ending, middle of the year, sort of May, June 24. There's a significant blip there. That was tens of thousands of people newly opting out. And what you find is you can correlate this to some media stories. So the other way of approaching this session was to go through a timeline of stuff I'd seen in the media that I just kept a note of. There's hundreds of stories in the media about data all the time. These are just some interesting ones and different ones I picked up that you may or may not have seen. So just go back to January. Just go back to January. The first thing I picked up was this: Tony Blair and William Hague, two ex-PMs, two other political parties, were talking about selling the NHS data to fund medical advances. The quotations there was how the journalists presented it. But it's quite a challenging piece around, well, if the NHS have got this fantastic data store, are we doing the most with it? You could spin that two ways. It could be a positive thing, a real asset of the NHS, a real thing we could use for benefit for patients. Or you could say everything's been sold off. And that really depends on your perspectives individually, and certainly how it's presented in the media. So that was one interesting article right at the start of the year. Then I moved into February, and a couple I just picked out from all my news stories in February. One was around the NHS, the oldest IT system in the NHS to be replaced. I think it was in Torbay down the southwest. And some of the systems they got were dating back to the 1980s. And actually, I recognize one of them because I'm sure I worked on it when I was a junior programmer back in the day. So fairly old. Now, it was an interesting niche story in some of the technical media, but what it demonstrated is that all the fantastic things we'll hear about artificial intelligence, machine learning, and integrated data and single records, are all underpinned by the basic IT systems that the NHS uses. And given the fact that Torbay have run something from the 1980s and have just committed to change it, doesn't mean change yet, this demonstrates the challenge collectively that we've got across the whole of the IT infrastructure of the NHS to make some of these big substantial changes at a national level. You're always underpinned by, held back by the weakest or the slowest or the most out-of-date type systems. The other thing I picked up in February was a news story, which was around the commissioning of new GP digital services. And there was a framework which NHS England defined, which was suspended at the time. I have to say, I needed to look and see whether that had been restarted. And the answer is I don't know. But there was a challenge around that, which meant that some of those digital services, that there was a delay to getting those things improved. And we know that GP services, GPIT systems, will underpin lots of the work the NHS needs to do around integrated records. Already does. But delays like that, I don't think are helpful to us. Then I moved on to March. This was an interesting one. This was something which was covered in the sort of scientific media, but not really in any of the mainstream media. Scientists struggle to access patient data, cost lives in the pandemic. Now, we all saw use of data during the pandemic, the charts and the graphs and everything. But this was an article that was based on a talk which was given at a scientific conference. I think it was Andrew Morris from Health Data Research UK was quoted, and he talked about the struggle that the scientists, data access, data researchers had in accessing data, even during the pandemic, had cost lives. And it's very rare that you'll see in the media this concept of costing lives. Now, we've pushed it for a while. If data saves lives, not using data is costing lives. I was hoping there was some quantification behind this article, but there wasn't. I couldn't find one. But the principle that we said not using data must be costing lives if you agree that data saves lives was picked up at a fairly substantial national scientific conference, but didn't get much coverage in the mainstream media. So average person in the street wouldn't have seen that. Then I moved on to April. Two from April stories I'd seen. One was around a problem that had been encountered because of data hadn't been shared, and it was somebody had died, and there was a contribution to that was because their data had not been shared. This was actually to do with data sharing between the GP practice and the prison service, and either certain settings or permissions hadn't been set. So it's some fairly basic information about the individual's health hadn't been moved through, and that was adversely affected them, and they eventually died, and this was a contributing factor to their death. Again, that was published in some of the mainstreams, but didn't get huge take-up. Real negative impact of not sharing data, and this was to do with direct care as well. And the second story was the Federated Data Platform. Federated Data Platform was something that NHS England have commissioned to run across the NHS, but the original contract to do this had been heavily redacted some months previously. So in April, the unredacted FDP contract was published, and lo and behold, not much happened because it all appeared to be fairly sensible, fairly clear, fairly bog standard type arrangements within a contract with a data processor. But it did demonstrate that you can be transparent and people don't worry about it and it doesn't cause harm and it's a positive thing to do. We get to May, and there's an interesting one. So this is where we got some incorrect warnings on opt-outs circulating. This was particularly around social media. And the reason I mentioned May is, remember that blip in the chart? That blip in the chart of the opt-outs, this is what caused it. It was some scurrilous stuff that went around within social media. It was a repeat of an interview somebody had made from a year or so previously, which was itself incorrect. And it circulated again on social media, got loads of shares, loads of coverage in social media, less in the mainstream. But this is a direct impact of that was the opt-out rates spiked significantly in that May period. And that was a direct result of that. So tens of thousands of people, because of something going around on social media, which was fundamentally incorrect, and you get more opt-outs. Now, none of those have ever opted back in. And this is the battle we continue having to fight. And then I'll skip through June to the rest of them. So June was interesting because there was a consultation on the NHS Constitution, which we put a response into, and there were lots of people who flagged up in the media that was gone on. There should be a much wider consultation around the NHS Constitution. Nothing happened as a result of that. And the other bit was TBI, Tony Blair Institute, published their harnessing data report, and this was picked up quite heavily in the media and the scientific media, and it's also now being picked up in the new government, which I'll come to in a second. This was around, could we make better use of our NHS data in a range of different ways? Sort of a think tank type report. Then in August, there were a couple of stories which I picked up. This is around a firm being fined after hackers stole records, which is generally what people hear about, and that did hit a lot of the mainstream media. NHS England mandating the use of the FDP has changed slightly the political stance, and this I think was as a result of the election. So whereas the FDP was up to NHS Trust whether they used it or not, and now it's been mandated, which is not potentially a bad thing. You could see if we're going to use data, if there's a a system of using data nationally for our benefit. Well, if it's there, why don't we use it? October, the Secretary of State's speech to the Royal College of General Practitioners Conference is worth a look, and I've got a couple of quotations from that in a second. And then in November, big thing for us was the Sudlow review. Professor Kathy Sudlow published her review around the state of data for research in the UK. Got a slide on that in a second. Another one I picked up again was around cyber attacks, cause minimal harm. Didn't get as much media coverage, but it did cover in the mainstream media. So the general thing was the negative things tended to hit the mainstream media. The other more faceted, more sort of nuanced things tended not to, but hit some of the more specialist media. But it's all out there in the public domain. I'm sure you'll have seen other stories as well as the ones I've seen. The other question I was asking myself at the start of the year was, well, we know that data access for researchers has been, let's say, problematic for many, many years. That's why Use My Data started in the first place, don't forget. So has it improved? Well, some things have improved in that environments and secure data environments being set up. So these are improvements in that there are a safer space in which researchers can work without giving data away to different organizations. So that's a positive thing. Has it improved access in terms of timeliness? I think it's a separate question. I think the jury's well out on that one. And have they really worked? Again, there's a lot proven there, but there's a lot of emphasis going into TREs and STEs, trusted research environments and secure data environments, as a better way of working with our data. I think it's a really positive thing. We've run some sessions on those in the past if you want to go and rewatch those again. There are some working models. So lots of TREs, STEs are fairly early on in their lifespan, but there are some other working models. So open safely is the one that people talk about mostly, where this is just sort of a federated data approach as well, where the data never really leaves an environment, but it's queried from those environments. But there are some limitations to that, not least what data is available within it, and then who can get access to it, and how scalable the whole thing is. But there's certainly some a lot of emphasis on the open safety model being seen as a positive step in making data more usable, more accessible for use, but in a safer way. How it will extend will be determined to a large degree, I think, by what happens in the next few months of government. I'll come to that. But in general, has data access improved for researchers? My own take, personal perspective, no. I don't think it has. I think there are significant delays still in the processes by which you get approved to get into the data. When you've got your approval, you might work as a researcher. You might work inside a secure data environment, or you might be given the data as an extract. But that approval process for me is still taking way, way, way too long. And there's some real effort needs to be put to make changes in that. There are commitments, but it's a question of delivery, I think. You mentioned the Sudlow review. So Kathy Sudlow is a professor, and she did a large review across the UK. She was asked by the last government to do it, to look at the whole situation of access to data for research across the UK in its widest perspectives. And that report took over a year to produce, and we put our own submissions in the middle of 2023. The report was finally published in 2024. It's a large report, it's a couple of hundred pages, and there's lots in there. I've tried to be subtle and take some bits out. So these are the main things I think I've read from the report. Access to data sets is difficult or slow. Data is accessible for COVID-19, but not for other health conditions, cancer, coronary heart disease, and other things. More complex types of health data don't have national data systems. And hey, barriers like these preventing hundreds of studies, hundreds of research publications being done that could improve, I would say, save lives. So those are the main takeaway things. I have to say, if you'd have asked me this same question and given me 10 minutes to respond to it glibly a year ago or 2 years ago, or probably 5 years ago, I would have probably said the same things with the exception of the COVID-19 piece. COVID-19 showed that data could be used, but that lesson hasn't been learned. So I think it was really good that the Sudlow review picked up on these things. It's been fed directly into government, but I didn't see anything there which was earth-shattering. The key for me is what happens next. So let's go on to that. What happens next? But certainly for this year, There were some developments in policy. So first of all, we got a new government, and they've got particular themes and priorities for the NHS. You'll see those three quite often get cited: from hospital to community, analog to digital, sickness prevention. Our data world would seem to sit firmly in the middle one, analog to digital, but it spans all three really. Other things that have been said from the new governments, this thing around patient passports. I'm not sure whether quotation of patient passports was said by West Streeting or was an article, was an interpretation by a journalist. But certainly there's been a push or a desire from the Secretary of State, West Streeting, to push for sort of a singular access to patient records, patient passports. So it may be called different things over time. I'm not quite sure the reality of where we are with that. So I might come to that in a bit. But there's a commitment there, which is really interesting because I think it's the first time we've heard that sort of commitment beyond something like the NHS app, which is a start. The other thing we've got with policy terms is a commitment to develop a new NHS 10-year plan. A large part of that will have to be digital IT technology data. And certain other groups are influencing that. So the Tony Blair Institute I mentioned, their harnessing data report has fed into things like the new NHS 10-year plan. I think one of their team is actually on a new group that's been created, this digital advisors group. And you can read about that on the web as well. It's just been announced. There is one, I think, remember, there's one person from a charity representation, which was reportedly to represent patients, but that's something which I wasn't awfully convinced about, shall we say. But you can read about those. That's just been set up. I don't even think it's met yet. And I've not even seen what the terms of reference or what the publication details are going to be, what it discusses and what it decides and what it recommends, whether that's all going to be behind closed doors. We don't know. My advice when you look at these things, these commitments, is have a look back at similar commitments from the past numbers of years. If you look at plans and strategies from 1 year, 2 year, 5 year, 10 years ago, you will find very, very similar commitments. And if they've not been delivered for 1 year, 5 year, 10 years, what's convincing us they're going to be delivered now? I think that would be my approach when I read all these different policies and strategies. Think about what happened in the past. Were similar commitments made? Were they delivered? And if not, why not? And what's different now? It's a good skeptical frame of mind to keep in. And I'm a positive person. And my last point is on the Sudlow review. This is to do with data for research, which is largely our domain as well. But is it going to be used properly to drive the policy, to drive the implementation? I'm hoping it will be. It's certainly got good coverage within sort of government and Department of Health circles. But all that work went into the report. We need to be able to use it. So the last reflection just on this year is, what about Use My Data? Well, you've seen the work we do. You're involved in it. Many of you. We've continued to run our education sessions. We've got members of formal places on the group, lots of different groups. There's just a few of them there of our members. We've also got our members on loads of those other groups as well in their personal capacity. And I'm on certain groups to represent Use My Data as well. Some of them are listed there. And we continue to feed all our members' voices into things like national consultations and reviews, many of you things I've already mentioned before. So basically our work has continued. What I would say is over the year, the scale of it has really grown. People are coming to us all the time to ask things, to ask for questions, ask for access to people. Can we put groups together? Can we do workshops? So the scale of things is really increasing. We're absolutely in demand, and the biggest problem we have is capacity to be able to do anything about all the things we're asked to do. So lastly, what about next year? What's coming up? Some of these things will be relatively factual. Some are my opinions. Certainly, we know the NHS 10-year plan is going to be consulted on, and we're going to have to put some effort into feeding more directly into that on an ongoing basis. The digital advisors group I mentioned will start work to advise in that. We don't have a foothold in there yet, but that might be something we want to push into as well as an organisation. We could certainly, for instance, write to the member, the charity representation who's going to be there to say, how are they going to try and collate patients, the public views to push into those things? Or are they just going to feed their own personal perspectives into this group? I don't know the answer to that. The point about a single patient record up in support or something, I don't know what that's going to be, but certainly we've been pushing for a long time about the benefits of us as individuals being able to see our own records and, hey, maybe even see where they're being used or access to what the benefits might be. So we're going to have to keep a strong eye on that. How fast that will go, I don't know. My guess is not very. I think there'll be a lot of talking, a lot of design. I think there'll be a lot of things that may be claimed, which aren't particularly potentially true because that's how things happen. But that's a big, big piece of work. It's not the sort of stuff you'll get happening in the next year, but something might start. What might work is the NHS app. So the NHS app has been gently extending itself into other areas, and I think it's proved relatively popular. There are problems in that not everybody can access the NHS app for various reasons, but as an app itself, it's proved useful. But I think we really need to see it change in the next year to begin to deliver much more benefits for us, to make it much more useful, practical things like, hey, booking appointments. I can't do that anymore on my NHS app. So there are some limitations. I think we're going to see some developments in the NHS app world. We'll definitely see, in my view, lots more rollout of secure data environments and trusted research environments. I think we will see a lot more integration across them. So certainly there are groups on this call who are actively engaged in bringing together the community of trusted research environments and secure data environments across the UK to make sure that we try and do things in a sort of standardized way, a conformist way, and a way which could be integrated in the past. I think we need to encourage that. So we're already on a couple of those groups as our members are. And there's going to be a lot of work in that. The other one, which is worth keeping an eye on, NHS England are consulting on consolidating clinical registries. There was something that came out mid-year with some concerns about what that would mean. So there's going to be a new consultation on consolidating clinical registries. I am not up to speed with what's inside all that, but it's something we need to keep an eye on. So that could be an interesting one that comes up in the new year as well. It would seem a sensible thing to do from the outset. The devil, of course, will be in the detail and how that integrates with all the other national data systems. And then of the national data opt-out, I think there's going to be a review of that and how effective it is, not least because the large-scale public engagement piece of work that NHS England are doing will include questions about how the opt-out works and how people feel about it and what would they prefer to see. So I think there'll be some developments on that as well. So that's my views about the next year. The last couple of bits are artificial intelligence, the buzzword. We've done a session on AI. You can rewatch it back. These are quotations that Wes Streeting gave conferences about seizing the opportunity which AI offers because of the data we've got. Yes, tick. The other one, quotation I pulled out from his long speech was the N in NHS is important. We've seen in the past where we've seen more regionalized views of data research. So regional secure data environments were set up, for instance, because that was seen at the time as being more acceptable to people. Now there's a strong push to keep the N in national has been important. I think we would all, certainly the members we've talked to and the responses we put in, recognize that national is national and we need to focus on national, even UK perspective. So that was interesting to see that get picked up by Wes Streeting as well. And the last two quotations from him, which I thought were even nicer because he recognised that he himself is a patient. And during his early months in government, read the first one, he's been struck by how loud the patient voice has been during his early exercise of consulting with people. It's almost the inverse of my experience in my average working day. Well, good. Be good to see how that voice is used and listened to and acted upon. But his last one was around, now he's in government, he's here to be the patient's champion. Good words. I think if that comes to fruition, that will do us a lot of good as well. So it's a slightly different take than we've heard from previous Secretary of States, for instance. And lastly, the other big thing that's coming up in the new year, of course, is our own National Patient Data Day Conference, 24th of June, the Queen's Hotel in Leeds. You've seen bits that have come out on the newsletter. You'll see on the bottom of the Secretariat's emails, there's a banner that tells you to hold the dates. The program's in draft stage at the minute, but it will try to make it interesting, interactive, and sparky rather than a traditional sit down and listen to somebody speak at your conversation and go and have a tea and then listen to the next person speak at you. It is not going to be that. It's going to be interactive and involving and as many patient voices in there as possible. So you can expect to see in the next month or so some more details coming in about that because we've now got an events person to manage that for us. So that was it. That was my rapid run through of what I thought happened last year and what things might come upon this year. What do you think? Did that make sense to people? Are there things you think that I've missed that are worth flagging, either for last year or for years coming up? And I'm going to stop my screen sharing.